Good afternoon. Good afternoon and welcome. Thank you to all of you who've come from all over the world to help us take mental health out of the shadows and try and make it a global development priority. And we've got a fantastic group of panelists here to talk to you today. But before we get on to them, I'd also like to welcome all the people who are joining us online. This event is going to be live streamed in English, French and Spanish. If you're a Twitter user, you can keep up with the conversation by looking at WBG_health or at WHO and using the hashtag mental health now. For those of you who are in the room, there'll be simultaneous translation through the headsets in English on channel 1, French on channel 2, Spanish on channel 3. This is really an incredibly important event. It's been a long time in the making. Hundreds of people have come together to make this possible, all organized by the World Bank and the World Health Organization. We're very grateful to them. Before we get started, we're going to have a short video just to remind everybody why we're here in this room today and why it matters quite so much.
Affect more than 600 million people around the world. For people suffering, everyday tasks can be difficult. So what are the roadblocks that prevent countries from addressing mental health? Stigma, inadequate funding, and poorly prepared health systems. The cost of lost productivity in the workplace due to depression and anxiety is very high too, over $1 trillion per year. But we also know that treatment for depression and anxiety is a worthwhile investment. Every dollar invested in treatment leads to a return of $4 in better health and ability to work. But governments in low-income countries spend less than 1% of their health budget on mental health. High-income countries invest around 5%. This is a critical time. Globally, only 1 in 5 people who need treatment for depression and anxiety are receiving it. Almost half of the world's poor are expected to live in a country affected by war and violence by 2030. Refugees and people living under such stressful conditions are at an even higher risk for mental health disorders. We also know that such traumatic events can have a major impact on a child's or adolescent's brain development and lasting effects on their health well into adulthood. Without action, the impact on people's mental health is likely to be on a scale we have never seen before. We can solve this by scaling up the work already underway and strengthening political will and leadership, integrating mental health into health systems, and increasing investments from national governments and international development partners. Let's bring this issue out of the shadows. It's time to make mental health a priority now.
Thank you. For those in this room who've been working on mental health for a while, this is a really big moment. Getting the stamp of approval of the World Bank and putting mental health forward as an important development priority is a big deal. And to give that stamp of approval, I'd like you to join me in welcoming Dr. Yong Kim to the podium.
Thank you very much. It's a great honor to be here. We have such a great panel, and we're very thankful to Mr. Prideaux from The Economist for being here. I want to thank Jen Hyatt from the Great White Wall for being here, Dr. Ballard from APEC, Mr. Koloko from the African Union, and he reminded me that we worked on Ebola together, Minister Morneau from Canada and the great commitment of the Canadian government and Prime Minister Trudeau to mental health. But I want to spend a little time specifically on my two good friends here. Margaret Chan. Margaret has been a great champion for mental health issues, and I think the leadership of WHO on this issue has been really terrific, and I want to just thank you, Margaret. But finally, I need to recognize Arthur Kleiman. Arthur has been my mentor and basically a father figure to me for more than 30 years. So I want you to know I really, really believe in tackling mental health issues. But I also want you to know that if we didn't do this, Arthur would have disowned me. So For me, it's been 30 years of listening to Arthur talk about this hidden scourge of mental health problems. And we did this once before. Arthur was a primary author on a major volume on mental disorders, but there just wasn't the momentum. And now we've really got to do something differently. So we know the story. Millions of men, women, and children are burdened by mental illness. Yet, as we saw from the video, mental issues remain in the shadows as a result of stigma, lack of understanding, resources, and services. 2 decades ago, we faced a very similar situation with HIV and AIDS. People affected by AIDS faced severe stigma, and it's for young people, it's often hard to even recognize that this would have been an issue with HIV and AIDS. And there was a widespread failure of policymakers to acknowledge or address the growing number of people dying in the world, especially in Africa, from the lack of access to affordable treatment. It was unjust, it was wrong, we made the case very strongly, and we contributed to creating a global health development movement that was in the face of what we knew would be a catastrophe if we didn't respond. Many of us were involved as activists. The people from ACT UP changed the world. There's no question about it. And we demanded action, and it happened. And from a time in 2003 when we were told that it would be impossible to treat HIV in Africa, that comments were made like, well, they don't even have watches. How can they treat HIV? To today, where over 15 million people are on HIV treatment, many of them in sub-Saharan Africa. And if we hadn't started that movement, it's hard to imagine that Africa would have grown at the rates that it has over the past 15 years. But now we need to put the same kind of energy, the same kind of activism into mental health and put this issue on the global development agenda where it belongs. Lots of good reasons. So, of course, there's lots of good reasons to do this. Estimates are that 10% of the world's population, including 20% of children and adolescents, suffer from some sort of mental disorder. Mental illness is the leading cause of years lived with disability and is linked to higher risks from major killers like heart disease, diabetes, HIV, tuberculosis, and even obesity. Among young women, suicide has become the leading cause of death, surpassing maternal mortality. The children of mothers who suffer from mental illness are much less likely to survive and more likely to be stunted. It's also becoming clear that the problem's growing. A 2015 Lancet study found that the prevalence of anxiety disorders increased by 42% and depressive disorders by 54% between 1990 and 2013. Mental health problems are also a major constraint to development. It's not simply an imperative for our efforts to achieve universal health coverage. It also constitutes a fundamental imperative for development. The vast majority, 80%, of people likely to experience an episode of mental disorder live now in low and middle-income countries. By 2030, we estimate that 90% of the extreme poor will live in settings of conflict and violence. Refugees and those affected by conflict, humanitarian and natural disasters suffer increased rates of anxiety and depression. If their healthcare needs remain unacknowledged and unmet, their employment and their children's future will be irreversibly compromised and will add to the cycle of fragility, conflict, and we fear extremism. Despite its health and development importance, though, the resources being put into mental health services do not come close to meeting the public health and economic burdens caused by this silent epidemic. On average, low-income countries devote less than 1% of their health budgets to treating mental illness. High-income countries devote an average 5% of their health budgets to mental health, which is far better, but still doesn't meet the scale of the challenge. We all pay the price for this lack of investment. In addition to their health and human impact, mental disorders cause a significant economic burden when people are unable to go to school or work and participate fully in society. Today, we're releasing new estimates showing that the global cost of lost productivity due to mental illness amounts to more than 10 billion days of lost work annually, or the equivalent of US $1 trillion per year. For economies to be competitive and have sustainable and inclusive growth, this is $1 trillion that we simply cannot afford to lose. The good news is that the two most common forms of mental illness, anxiety and depression, respond well to a variety of low-cost treatments. And the returns on this investment are substantial, both in terms of increased productivity and community participation. Each dollar invested in easily scalable mental health treatment and services for depression and anxiety returns about $3 when economic benefits are considered. Even more compelling is the growing evidence from countries such as Afghanistan, Ghana, and Peru that outcomes for mental health services can be very good. They've shown that it's possible to scale up and integrate mental health services even in difficult and resource-poor environments. I've seen this firsthand in Carabayllo, in Peru, where I started working in 1994 at Partners in Health. At that time, I led an initiative to treat patients suffering from multi-drug resistant tuberculosis, the most stigmatized of all infectious diseases at that time, and just about every single one of our patients were depressed. In fact, some of them, because of the medicines, actually became psychotic. So we began a community-based treatment program, and now the town of Carabayllo, and is the mayor here? I think the mayor of Carabayllo is here somewhere, maybe not in this room. Buenos días, alcalde. So now, Carabayllo, the town that I've worked in for so many years, is on the front lines of another big change, this time in mental health. It's one of 21 community centers in Peru which integrate mental health services into primary health care. The program requires the direct involvement of the community and the family of patients. Where once all patients were hospitalized, most now receive integrated services through home visits. This change has happened because of the coordinated efforts of the Ministry of Health, the National Institute of Mental Health, the local government of Carabayllo, and several international and national organizations. Other communities can and must learn from Carabayllo's experience. In closing, Sustainable Development Goal number 3 has set a target for universal health coverage by 2030. If we're going to achieve that goal, and if we're going to end extreme poverty and boost shared prosperity, we can't let this invisible epidemic impair individuals, communities, and economies. So today, together with WHO and many partners represented in this room, we're kicking off an important global conversation and a call to action. We want all of you in this room and those listening in to join us. Let's bring the issue of mental health into the spotlight, and let's keep it there. This isn't just a health issue, it's a global development issue. Governments, international partners, health professionals, community and humanitarian workers, we all must do our part. I give you my personal commitment that throughout the world, as we work on building healthcare systems, that now not only are the thing that we're doing for universal health coverage, it turns out that those healthcare systems are also the critical piece of building pandemic response systems. But in the process of doing it, this time, we will not forget mental health. We will follow the lead of communities like Carabayllo and integrate mental health now into primary healthcare programs everywhere. And finally, give this problem, mental health problems, the attention that it has deserved for a very, very long time. Thank you very much.
Thank you, Dr. That's great.